Thanks, Alyssa. Can you guys hear me all right? I think I have it loud enough here.
Yeah.
Uh, Perfect. Thank you. So greetings. First off, thanks, Dr. Farnan. I seriously love hearing about SCAD and having all that research kind of up to date and having all that material for me. I really, really appreciate that. Just kind of fun to hear and learn more about this kind of weird, rare disorder. But to start my story, my name is Hannah. I am, like Alyssa said, I'm a nurse at Essentia Health here in Fargo. Honored to be speaking with you all and here to tell my story and share my heart journey. Thanks for having me. Any opportunity to speak out about my heart condition and heart journey has kind of been an aspiration of mine. Trying to use this experience and kind of what I went through for good with the platform that I have as a nurse to kind of use my voice and educate when I can. I want to share a time with you in my life where I was forced with situations and circumstances that were super unfortunate and literally broke every being of me physically and mentally, and how the tables got turned on me and I became a patient. Go ahead and with the next slide. I have nothing to disclose here, so we can go ahead and jump to the next one. Alyssa said a little bit about me. I'm just going to kind of recap on that again. So I'm a Fargo native, born and raised. I went to school here in Fargo, went to Oak Grove, went to the University of Jamestown, or it was Jamestown College when I went there for nursing school. So I was a student athlete in high school and then continued that into high school. I always knew I wanted to be a nurse, wanted to help people, but sports were a huge part of my life. Very involved, very healthy, no health history at all, and no familial background history of any kind. Go ahead with the next slide. In school, I had to study really hard to pass. I was not the bookworm, typical student. I struggled in school trying to juggle both prioritizing my school and trying to remain a one sport athlete. At one point, didn't think I'd make it through, but it took a huge toll on my mental health. But it was a challenge that I'm grateful for now. Surviving school, something that didn't come easy to me, but it kind of in a way was preparing me for these challenges that were going to be coming down the line. Go ahead with the next. Again, a little bit more about me. Since graduation, I've been a nurse with Essentia for 9 wonderful years. Started out on this cardiac telemetry unit. I am a big fan, always been super involved with cardiac, cardiology, cath lab stuff. And then I kind of evolved into a cardiac intermediate care nurse where I kind of took on more of a leadership resource nurse role. And in the years that I was on these cardiac floors, it's about 7, 8 years, I had never heard of SCAD. I've never heard of heart attacks happening to young people at all. So that was kind of interesting. But the last 3 years, I've been with the administrative supervisor role at Essentia with the one call, and I love it. It comes with its challenges, has lots of responsibility, but coordinating of care for people when they're in kind of tough situations, especially during the pandemic when I started, it's super rewarding getting to kind of help patients all over the state and then kind of help come to our facility as a place that I trust. So today I am married with 2 beautiful children, Callan, who is 6, and I have a daughter, Ellie, who is 3. And that's where my heart journey kind of starts. And when my daughter, Ellie, was born, my heart kind of took a turn during the postpartum period with Ellie back in July of 2020. And go ahead to the next slide. So this is my Ellie. So she was born in 2020, classified as one of those COVID babies to some. As we remember, it was a crazy time to be alive, very stressful. COVID was scary, intimidating. And I was a pregnant mom. This is my 2nd child at that time. So a lot of stress, but I had done this before. So just kind of trying to keep it as routine as possible. Prenatal care during 2020, if any other moms are hands-on just for germs. Fetal checks, I remember we were doing in the parking lot of Essentia. I remember like laying back in my car and getting Doppled. Again, it was a very strange time. But in the birthing center during Ellie's delivery, there were no visitors other than my husband. He wasn't able to come and go as he pleased. So it was just kind of a high intensity, high stress time. Delivery for Ellie was, thank God, unremarkable. She was healthy and perfect. And I was feeling great. Ready to go home, be with my son, and kind of to hopefully have my family be ready to meet her. And I was discharged 2 days later. I just want to touch on a side note. So this last part of the slide here, I had missed one of my best friend's wedding. She had a destination wedding in Montana. And because of Ellie's birth date, I wasn't able to make that. And I was dealing with a lot of personal guilt at that time, very high emotion, again, kind of highlighting this high stress time in my life. Go ahead and go into the next slide. So the postpartum period, again, everything started to change. When Ellie was about 4 days old. Looking at these pictures were from her newborn photo shoot that happened at our house. And I personally kick myself still to this day because I feel like I should have known something was wrong. I feel I can see it in myself that I wasn't well. I remember we almost didn't do the shoot because I thought maybe I should go and get checked out. Again, adjusting to these 2 babies at home, I was going through a lot of emotion, feeling very isolated, as a lot of unfortunate postpartum women do. And again, like being afraid to be around everyone kind of heightened everything, families included. We were just terrified to be around each other. It was just a very, very strange time. I remember mentioning these emotions and feelings, to my OB providers on our virtual visits, and explained, these emotions were kind of flying around, but they felt that this was really pretty normal, that nothing to be too concerned about, just to kind of keep an eye on them. But I also described that I was kind of feeling fatigued, short of breath with very simple activity. I almost felt anemic is kind of the best way I could describe it, because I have been anemic in the past. But they weren't sure about that. My lab work was fine. Didn't really know what to say about that. Thought we'd keep an eye on that. But these symptoms, this fatigue, shortness of breath, worsened with each day that passed. I have a family full of healthcare workers, nurses, and other healthcare professionals, and they really urged me not to ignore these symptoms. But I really just wanted to feel well so I could be with Ellie. I just kind of pushed those aside and tried to push through it, as we all do. Next slide. Again, just kind of bringing these symptoms to the surface again. I felt fatigue, very winded with activity, short of breath with laying down and position changes, and then dizzy when I stood up. I remember feeling like chest twinging. I wouldn't call it pain, but again, when you're postpartum, your breasts, are engorged, and you have a lot of pressure on your chest anyway. But I definitely knew that it wasn't normal, like what I was feeling. I had not felt this way with my son. I remember laying at night, laying in bed and being like super hyper focused, feeling my pulse, feeling like it was super slow. I think my heart rate at times was in the 40s. So hindsight, what was going on there, on my EKG, it was unknown. But thinking about those photos, after the photo shoot, I did end up going in. I didn't want to leave my daughter, but I agreed that I needed to take care of myself, so I could be there for her. And this would be one of my 2 trips to the ER that week. In the ER, I was worked up thoroughly. I was scanned, lab work was done. They found nothing, no clots, no findings on my chest x-ray. Told this was possibly anxiety, or again, that fluid shifting around after baby, but not to worry. So I was discharged home. Everything in my postpartum body looked good. No bleeding, no clots, nothing. It was a very helpless feeling, feeling almost like a crazy person. My family jokes that nurses would never go into the ER unless we were actually dying. But that's how sure I was that something wasn't right, like we were missing something. Something wasn't right. Next slide. So things started to change August 4th, 2020. I remember being out on my deck here in August, beautiful day, talking to my neighbor. And I remember I wasn't able to stop salivating, just swallowing like crazy. It almost felt as if there was like a lump of bread developing in my throat, kind of a tightness feeling. Heartburn, maybe, kind of unsure. I remember I got into the kitchen and I just, stood there, and I told my husband, I was like, I'm really just getting annoyed with this whole situation. Like something is going on. I had heartburn during pregnancy, so it wasn't an uncommon symptom to have maybe some indigestion, but it was followed with this awful nausea, and the pain just kind of intensified. I started to feel very anxious with this. I took a handful of Tums, but nothing would stop that pain from intensifying. It moved from my throat, and then it moved down into my sternum. I remember I called for my husband to come and help me. At that point, I felt that I had lost control. I got down onto the ground in my bedroom, and I remember crying out, "I just want this to stop. Please make it stop." This went on for a few minutes while my 3-year-old son and my husband watched helplessly, unsure what I wanted or needed them to do. I didn't really know what to think. In my mind, I had just been given this false kind of hope from the ER that this was nothing to worry about, that this was your anxiety. And I was getting so angry about that. I just wanted some relief. It was a terrible memory that I will never, ever forget. And then something happened that I couldn't ignore. Both of my arms went numb, and I could not pick them up off of the floor. And I knew it at that time that that was a heart attack. How could this be? I am 29 years old. My husband called my mom, who rushed over and took me to the ER for the second time that week. We probably should have taken an ambulance, hindsight, but I'm stubborn. So we drove there in fear, but we drove there. In the ER, I was in absolute shock. I remember laying on the cot, feeling almost lifeless. They hooked me up to EKGs, took more blood work, and worked me up very diligently. The doctors believe it to, again, be an anxiety or panic attack, maybe this time, until my lab work came back. Next slide. My troponin initially on admission or on visit to the ER was 0.04. It jumped up to 14.7 and then up to 30.5. And this was the non-high sensitivity ones. These are regular troponin levels, which confirmed that I had indeed had a heart attack. I remember the ER doctor coming in and saying those words to me, almost not believing it himself, that I had indeed had some kind of MI. I remember I just broke down and I covered my hands with my face, almost a sense of relief cry though, feeling or proving that I wasn't making this up. But what could this mean, and why was this happening? My chest pain resolved with medication, planned to be admitted to the hospital. Further testing in the hospital had showed that there was some ST changes, like some depression happening on my EKG, that indeed an MI had occurred. The ED provider assumed that this could be this rare disorder called SCAD, but we needed further testing to confirm it. And that was the first time that I had ever heard SCAD. I was hospitalized at Essentia on the cardiac floor that I was actually working on at the time. My coworkers, bless them, were the ones that were taking care of me. There's people I trusted the most, and I felt very vulnerable with them, but almost bad for them at the same time. Watching a fellow nurse struggle the way that I did, knowing me personally and watching one of their own struggle like that, I can't even imagine. The doctors highly medicated me. It was Ativan every hour, just trying to keep me calm. Anticoagulation and started, consulted with a cardiologist. Go ahead to the next slide. That next evening, I met with a cardiac interventionalist and planned for my angiogram. This was my first angiogram. During the procedure, it showed that I had indeed had these SCADs or dissections. The first one was in my right coronary artery, and then a possible dissection happening in my left main artery down into my LAD. I remember in school them talking about that left main as the widowmaker, and those things never leave you. So of course, I'm really starting to get pretty worked up at this point. I just wanted to share this image on the right here. Rory did a great job showing these on his actual angiogram slides, but I like to see what a common plaque in an artery looks like versus like with a SCAD. And I was unaware that arteries have layers at all, that they can kind of actually fold kind of off themselves like they can and cause those blockages. And then again, just these vessels that I highlighted, those were the ones that were affected in my case. Next slide. After my angiogram in recovery, I was no longer having the chest pain, but I was not out of the woods. I was still seriously trying to figure out how to best manage this. It was very serious. They didn't know what we wanted to do. It was a 29-year-old postpartum woman, young nurse. It was kind of an anticoagulation and waiting game at that point. The decision was made that I possibly needed surgical intervention, and again, to speak with a cardiovascular surgeon who was comfortable with managing this sort of thing. I was transferred to Sanford and Fargo during the night and was admitted to their ICU. Still highly medicated at this time, I was numb. Unsure of what I thought was going to happen next, and just hoping that this nightmare was over. Next slide. The morning of August 6th, another day I will never forget. In the ICU at Sanford, I remember waking up and opening my eyes to the sun coming through my window. And I remember rolling off of my right side onto my back, and I felt this excruciating tearing in my chest. It was crushing 10 out of 10 chest pain, way worse than before. My first episode of heart attack that I had at home, I would rate that about a 7 out of 10. This was my 10. I freaked out. I was screaming. I remember yelling at the poor nurses even at the time, even told them at one point to move faster to get the intensivist. I felt like I was actually dying at that time. Unfortunately, I found out that I am not nice when I am in pain. Saw the little worse version of myself those days coming to the surface. I remember screaming down the hallway, being rolled to the cath lab. People were rushing around. I had a nurse at my side holding my hand, trying to get me to calm down, but I couldn't. I appreciated her being there, but I was in a fight or flight mode and I was fighting. I remember a cardiologist coming into the cath lab, and it was Dr. Huldis. I remember him getting right up into my face, and he sternly said, "Hannah, we got you. You need to lie down." So I did. And that was the last thing that I remember. Next slide. While attempting to fix my blockages on the table that day, I went into a ventricular tachycardia, then VFib, which they lost my pulse at that time. Because my plumbing or my vascular system was failing, my electrical system started to fail me too. I cardiac arrested that day and was shocked 13-ish times by staff while they tried to jumpstart my heart. They rushed me to the operating room while performing CPR down the hallways. There was the cardiovascular surgeon who was bumped. She actually bumped a different heart case and took mine instead. They were able to stabilize me. Next slide. They performed an emergent coronary artery bypass graft ×2 cabbage. They cut the veins and arteries from my wrists and my legs and were able to reroute the flow to my heart. I've seen this done to my patients many a times, but after having it done to me, it's magic. I still can't even fathom how that works in that situation. And I'm so thankful for healthcare and as advanced as it is. Otherwise, I know I would not be alive today. Next slide. 38 hours later, I woke up. I was in the ICU again at Sanford. They had me in a ventilated coma to let my body and my hormones relax after the last few days. I remember waking up to a woman named Dr. Newman, and I knew her name just from being in the heart world. I knew that name, and I was not surprised. I knew what had happened without even having to look down and see for myself at my own body. I remember I grabbed onto her arm, and I was just so overwhelmed. I had tubes and lines everywhere. I had chest tubes, obviously in my chest. I had IJ in my neck, IVs everywhere, big bandages all over my body. I felt almost too heavy to move at all, to lift my own body. It was a lot. Next slide. The post-operative days, I was almost completely immobile at that time, unable to move my arms, feeling like they almost were like dead weight, like dumbbells in my hands. My legs had bandages on them, and I had this broken sternum. I had no core strength, had just had a baby, and my breasts were still engorging, and they felt like they were actually going to tear my incision wide open. I remember being surrounded by my family and them being so happy to see me. I can't fathom what the last 38 hours had been like for them. I remember waking up to a wall full of pictures of family, friends, my babies, my dogs, cards and flowers, well wishes everywhere I looked. I was overwhelmed by all the support. But I started to really realize something else too in the midst of all this, that these doctors and nurses and technicians and therapists were there. They were there the whole time. Day and night, these nurses ran the machines that kept me alive and breathing. They gave me medications. They used teamwork to protect my skin, cared for me when I was in pain, provided dignity and empathy to me and myself and my family. All the things that I had used in my work for years, now being used on me. It was incredibly humbling. I remember the physical therapists and learning to walk again. My legs feeling like I had cinder blocks for feet. Using stairs were terrifying, feeling like I was going to fall down a literal cliff. Each step was a victory those days, literally for me. Next slide. I'd sit in silence a lot, getting ready to go home, and my nurses would ask me if I was okay, just thinking about so much, going through everything of almost dying, trying to remember what was even real and what was a dream, thinking of my kids, missing them so much, but wondering what they would think of me now and not wanting them to see me like this. I learned what it was like to ask how to ask for help. Asking is not an easy thing for me, never has been. I'm a woman, I'm a mom, I'm a wife, I'm a nurse. We're stubborn. We like to think that we're tough. But now with these broken bones, this broken mind, I was a broken mother and had this broken idea of what I had in this plan for my life. All that kind of came to a halt. I needed help with everything: bed baths, eating, going to the bathroom, physical therapy, getting on my own 2 feet, putting my feet on the floor, walking, learning how to use the stairs, balance, and figuring out how I'm going to be a mother again at my home when I can barely care for myself. And that was bottom for me. Over the next few months, I healed. It was very slow and frustrating, being so dependent on everyone else, being that I couldn't pick up my own daughter, couldn't drive a car, shower on my own, dress on my own. I had to wear oxygen for a few weeks and lugged around this big oxygen concentrator with this long hose for months. But something I do want to share with you all is this talk that I talk about with my new glasses that God gave me. I had a lot of time to think about what was important and what wasn't during this recovery. TV was so strange when I woke up and got home from the hospital. All the politics, social media, entertainment, all completely irrelevant. Food channels, reality TV, so strange. Friendship dramas over 20 years simply fell away. Like, important. And I saw what was important: being there for my children, to see their faces, to be around for their failures and their achievements, to be a good wife, and to love any chance I get. Being a nurse is important to me too, though. Being a part of someone's lowest lows is important, and I intend to return that favor and to educate, to do something with this experience and talk with people like you about SCAD. Next slide. So what now in my recovery? The next slide. I completed my cardiac rehab program and regained some of that core strength. I was able to start doing like cardio, cardiac monitors often. I remember back in 2020, during my first day of cardiac rehab, I was sitting at a table full of these older men who also had open heart surgery. And I sat at the table and they thought that I was their instructor. Like, they all were just wondering what on earth I was doing there. And it was pretty funny. And I think they were quite surprised after hearing what happened to me. But I learned how to do yoga, learning to stretch, and stretching without pain today is still something that I'll never take for granted. I learned how hard it is to use incentive spirometer, something that I teach my patients all the time. That is a very difficult thing when your lungs have lots of fluid and pressure on them. Dr. Farnan talked a lot about FMD. I also got tested for FMD following surgery, which I do not have. That was not something that was in the cards for me, but today I wear my scars proudly. It's kind of my personal tattoo of strength and what I live to, and my reminder of my perseverance. It's something that I honestly don't ever want to forget. Medications. I am a heart failure patient. I'll be on medications for heart failure for life. I take Entresto twice a day for heart failure, as well as beta blockers and aspirin, which is the standard, like Dr. Farnan talked about. Echocardiograms I just want to share with you. So after surgery back in 2020, my ejection fraction was 38%. I had a lot of labeled areas of scarring and dead tissues, especially in my septum from the cardiac arrest. And I was borderline candidate for an AICD at that time. My most recent echo back in January of this year, in 2023, actually read normal, which was an EF of 50 to 55%. Pretty amazing. I never thought I'd be anything but a normal heart patient for my life. So I'm pretty excited about that. And I, of course, will forever be at risk for having another SCAD. And I know that. I see a counselor regularly for trauma and PTSD, as well as I do this EMDR, which is like an eye rapid therapy that helps a lot with trauma. And that's really, really helped a lot through this process. I'm back to work full time in a different position, had to leave the floor just due to my endurance, but back to kind of doing something normal, back to doing what I love, caring for other people other than myself, thank God. But I'm a survivor. I'm back playing soccer. I'm a mother, I'm a wife, I'm a daughter, I'm a heart patient, and I will require care for the rest of my life. And I love with all I have and push through adversity that I face, not just for myself, but for people around me that are counting on me. Next slide. So please remember my story and remember SCAD and who it can affect. It is not the typical idea presentation of what you would think of a heart attack patient or candidate, but indeed there is criteria for young, healthy people like me who are at risk for this. Thank you all for listening. I'm hopeful, Alyssa, if we have time, we can still go ahead and play that video on the next slide. It's a video that I made of kind of the journey from surgery, just some pictures that we have. And then it's also got one of my favorite songs on it. It's called Tell Your Heart to Beat Again by Danny Gokey. And I hope you guys enjoy. Thank you. Alyssa, I don't think the sound is on that.
Let me fix that.
Thank you. It's much better with the music.
It is. I would agree.
Yeah.
I will fix it. Thought I'd flex it. There we go. Let's try this again.
Shattered like you've never been before. The life you knew in 1,000 pieces on the floor. And words fall short in times like these, when this world drives you to your knees. You think you're never gonna get back to the you they used to be. Tell your heart to beat again. Close your eyes and breathe it in. Let the shadows fall away. Step into the light of grace. Yesterday's a closing door. You don't live there anymore. Say goodbye to where you've been, and tell your heart to beat again. Beginning, just let that word wash over you. It's alright now. Love's healing hands have pulled you through. So get back up, take step one. Leave the darkness, feel the sun. 'Cause your story's far from over, and your journey's just begun. Tell your heart to beat again. Close your eyes and breathe it in. Let the shadows fall away. Step into the light of grace. Yesterday's a closing door. You don't live there anymore. Say goodbye to where you've been, and tell your heart to beat again. Picture that reminds you who has carried you this far. 'Cause love sees farther than you ever could. In this moment, heaven's working everything for your good. Tell your heart to beat again. Close your eyes and breathe it in. Let the shadows fall away. Step into the light of grace. Yesterday's a closing door. You don't live there anymore. Say goodbye to where you've been and tell your heart to beat again. Your heart to beat again. Beat again. Oh, so tell your heart to beat again.
Surprise!
That's all I got, guys. Thank you so much for your time.
Thank you so much for sharing your story with us, Hannah.
I'm glad to